it's possible that they can also develop into cancer years down the road. Lupus is an autoimmune condition that can be developing over decades of time. People having lupus, the first test to show that they may have lupus is that they have anti-nuclear antibody positive. But that is not the definitive test to conclude that they have lupus. People who having lupus, they would have symptoms such as butterfly rashes on the face, lung problem, kidney problem, liver problem. It's systemic. That's why it's called systemic lupus. It's basically your body is creating antibodies attacking tissues all over your body. So they can have joint pain as well. They can have sleep problem disorders. So people having lupus, they can have many different symptoms because many tissues and organs in the body are attacked by the antibodies. So some symptoms of lupus include fatigue, joint pain, joint swelling, difficulty breathing, kidney failure eventually, and also rashes around the face as butterfly rashes. That's the typical symptom of lupus. The traditional treatment of lupus are using immunosuppressive drugs to suppress the immune response that's attacking the patient's tissues and organs inside the body. And some new treatment also include hematopoietic stem cell transplantation that has shown some effect in treating advanced stage lupus. Immunosuppressive medications for lupus are only treating the symptoms, not treating the root cause, because the root cause is the body creating antibodies attacking the tissues. And the immunosuppressive drug is just to putting out the fire that's already spread to other places and now looking into the source of the fire. And many people on long-term immunosuppressive medications, they develop resistance to the drug and they still have flare-ups from time to time, and then the conditions of lupus still progresses. The major side effects of taking immunosuppressive medications for only alleviating the symptoms of lupus is the increased chance of infection, because you're basically suppressing the immune system as a whole, not differentiating between the internal autoimmune attacking your tissue from the outer pathogens attacking your body. I believe using hematopoietic stem cell transplant can reduce the aberrant or abnormal immune cells that are creating the antibodies that are attacking your own tissue and organ. But the possible risk of doing hematopoietic stem cell transplant is that first, you have to find the perfect match for the hematopoietic stem cell transplant. If the cells are not matching your own body's phenotype, it can create rejection inside your body. Then the second possible risk of hematopoietic stem cell transplant is that hematopoietic stem cells are tumorigenic in some cases. So then it's possible that they can also develop into cancer years down the road. Mesenchymal stem cells from the umbilical cord are excellent at regulating immune system and also not causing any rejection in the recipient's body because they are lacking the receptors for the immune system to react on. So mesenchymal stem cell treatment can be a promising strategy for treating the root cause of lupus condition, plus not causing the side effects as the immunosuppressive medications or the new hematopoietic stem cell transplant. However, for mesenchymal stem cell treatment for lupus, for advanced stage, it is possible that people need to do multiple treatments, maybe more than 3 or 4 treatments in a year to make it effective. So it can be a financial burden for a lot of patients when they are not able to access this type of treatment. So long-term emotional stress may exacerbate the progression of lupus or any kind of autoimmune conditions. People with tremendous amount of stress in their family life or work can develop more flare-ups in lupus. Besides any treatment, either conventional or stem cell treatment, people with lupus, they need to try to look into their lifestyle to control the stress in their lives so that they can reduce the progression and the frequency of flare-ups. Because every flare-up, they actually aggravate their symptoms more. So if they have more frequent flare-ups, they would progress faster in the advancement of the disease. Mesenchymal stem cell treatment for lupus is a viable and promising solution to help many people suffering from lupus for decades without the regression or remission of the conditions.